Welcome back to Head and Neck Sessions. Today's topic is on tongue. So let's see some few functions of the tongue. We know the tongue is a conical muscular organ which is located in the oral cavity and partly it is located in the oropharynx. So it helps in taste sensation, it helps in speech. Tongue also helps in facial expressions to make several facial expressions, and also it helps in mastication, that is chewing, and deglutition, that is swallowing. And in lower animals it helps in thermoregulation. So we can know the taste is because of the taste buds which are present within the mucosa of the tongue, and these taste buds, each part of the tongue, each kind of taste buds are responsible for different taste. So the tip of the tongue for sweet taste, the middle of the tongue for salty taste, and lateral side little posterior for sour taste, and posterior most part of the tongue where circumvallate papillae are located, that is meant for bitter taste. So tongue, basically we can see it is divided into two parts, anterior 2/3 and posterior 1/3. It has got the base which is connected to the epiglottis posteriorly. So here we can see, here is the epiglottis, and posteriorly the tongue is connected to the epiglottis by means of glossoepiglottic folds. The fold between the epiglottis and tongue. Tongue is otherwise called as glossa. So the fold is called as glossoepiglottic fold. So there are two lateral glossoepiglottic fold, and one which is in the midline is called as median glossoepiglottic fold. And what you are seeing here is the dorsal surface of the tongue, and the lower surface or the inferior surface is called as the ventral surface of the tongue. And dorsal surface, we can see several elevations which are formed by the mucosal membrane, and it is covered by stratified squamous non-keratinized epithelium. The epithelium which is covering the tongue is stratified squamous non-keratinized epithelium, except the tips of some variety of papillae, which are the elevations called as filiform papillae. So the tips of filiform papillae contains keratin. Remaining the rest of the tongue is non-keratinized epithelium. And the tongue is divided into anterior 2/3 and posterior 1/3 by a sulcus, a V-shaped sulcus we can see, which is called as sulcus terminalis, and the apex of the sulcus terminalis is directed posteriorly, and the tip of the apex contains a blind foramen which is called as foramen cecum. Developmentally, foramen cecum gives rise to a duct which is called as thyroglossal duct developmentally, but before birth it gets completely obliterated to form foramen cecum. So anterior 2/3 we can see several kinds of papillae which are present: filiform, fungiform papillae, foliate papillae, and circumvallate papillae. These are vallate papillae or circumvallate papillae. So these are the varieties of papillae. And posterior 1/3 we can identify it by some round small elevations which are called as lingual tonsil. It is identified by lingual tonsil. And foramen cecum is located at the apex of V, that is sulcus terminalis, which indicates the embryologic site of origin of embryonic thyroglossal duct. And lingual papillae are small, and they are like nipple shaped projections present in the anterior 2/3 of the dorsum of the tongue. So these lingual papillae are filiform, fungiform, then circumvallate, foliate papillae. Circumvallate papillae are arranged in the front of V-shaped sulcus terminalis, and they are studded by numerous taste buds and are innervated by a nerve called as glossopharyngeal nerve. And remaining all papillae, the taste buds are innervated by cauda tympani nerve. Fungiform, fungus. Fungiform means it is fungus, means mushroom. So the upper part of the papillae is a mushroom like broader upper end, and lower stalk is narrower. Such papillae are called as fungiform papillae. So here we can see filiform papillae with conical tips, and the tips contains keratin. So that is the reason some consider the tongue as orthokeratinized epithelium, because it is partially having keratin. And we can see here foliate. Foliate means leaf-like papillae. They are not mainly seen in the adults. They are seen in the children below 5 years, or they are more prominently seen in lower animals like rabbits. So these are the foliate papillae which are present on the lateral side of the tongue. Fungiform, the upper part is the broader and lower part is the narrow. And the upper broader part contains the taste buds. Such papillae is called fungiform. Circumvallate. Circumvallate, as the name suggests, circum means surrounding, vallate means sulcus. So it is surrounded by a circularly running sulcus around it, and this is button like an island projecting in the middle. So this one is called circumvallate papillae, and taste buds are mainly studded on the lateral side. We can see on each side of the circumvallate papillae the taste buds are seen. Fungiform papillae taste buds are seen on the dorsum side. Filiform devoid of taste buds. Foliate papillae also contain taste buds laterally, and foliate are not seen in adult humans. They are, if they are also, they are very less in number. They are more prominently seen in smaller children, or they may be seen in the lower animals more prominently. Inferior surface of the tongue. So we saw the external dorsal surface of the tongue and its features. So inferior surface of the tongue, this is the inferior surface when you lift the tongue upwards. It is identified by a shiny mucous membrane, and in the midline there is a mucosal fold of attachment which is called frenulum linguae. This is called frenulum linguae or frenulum of the tongue. Then sublingual papillae, the elevations which are formed by the sublingual salivary glands beneath the tongue are called sublingual papillae, and we can also appreciate the opening of small ducts which are submandibular ducts or Wharton's ducts, and on each side of the frenulum linguae we can appreciate the deep lingual veins present on each side, which imparts bluish color below the tongue, and the fold of mucous membranes on laterally is called as plica fimbriata. It is called plica fimbriata, and we can see the how the tongue is attached to the floor of the oral cavity, which is floor of the mouth, which is called as the root of the tongue. This is the root of the tongue, and the root of the tongue attached to the floor of the mouth extends from the symphysis menti, extends from the symphysis menti up till the hyoid bone. So the tongue attaches to the symphysis menti, and up till the hyoid bone it is attached. Styloglossus, as it is attached on each side of the tongue, when it contracts it pulls the tongue back. So it helps in retraction of the tongue. And then there is a muscle called as palatoglossus, which is not shown here. Palatoglossus is from above, which is from the soft palate to the sides of the tongue, and it pulls the tongue upwards. It helps in the elevation of the tongue. So these are the main extrinsic muscles. There is a muscle called as chondroglossus. Chondro means cartilage. So it is getting origin from the cartilage which is near to the hyoid bone. It is actually a part of hyoglossus muscle only. So that is called chondroglossus, which is also not demonstrated in this image. Let's see the intrinsic muscles of the tongue. Intrinsic muscles get origin within the tongue and insert within the tongue itself. So superior longitudinal muscle. Superior longitudinal muscle runs superiorly. This is superior longitudinal upper dorsal surface of the tongue. It runs like this along the dorsum of the tongue. Similarly, inferior longitudinal present in the lower part of the tongue. Then transversely running fibers are called as transversalis muscle. Vertically running fibers are called as verticalis muscle. And we can see the cut section of palatoglossus, styloglossus on each side, hyoglossus present on the laterally, and genioglossus forming the substance of the tongue. So let's see the actions again. The extrinsic muscles, I said they alter the position of the tongue. Intrinsic muscles alter the shape of the tongue. Genoglossus, it protrudes the tongue and makes the dorsum concave. It protrudes, its main action is protrusion. It helps makes the dorsum of the tongue concave, and it also considered as the safety muscle of the tongue, because when unconscious the person's head to be turned laterally, otherwise it falls back because the genoglossus may be inactive during the person is unconscious. Hyoglossus, chondroglossus, I said they are together, and it depresses the tongue, makes the dorsum convex. Styloglossus, which is attached on each side of the tongue, it retracts the tongue backwards and upwards. Palatoglossus elevates the base of the tongue. Next, about the intrinsic muscles, superior longitudinal muscle which shortens and makes the dorsum concave. It is attached on the each side, so it contracts, makes the dorsum of the tongue concave. Inferior long, it also shortens the tongue but makes the dorsum convex. Transversus linguae, it is transversely present, makes the tongue narrow and elevates the tongue. Verticalis linguae makes the tongue broader. So these are, that was about the muscles and their action. Like, let's see the nerve supply, the motor supply. All these muscles developmentally they are from occipital myotomes except palatoglossus. Palatoglossus is a part of soft palate muscle. So except palatoglossus, all the muscles which are derived from the occipital somites or occipital myotomes, they are all supplied by hypoglossal nerve, that is the 12th cranial nerve. So all the muscles of the tongue are supplied by hypoglossal nerve, 12th cranial nerve, except palatoglossus, which is supplied by vagus, and 11th cranial nerve, which forms pharyngeal plexus to supply the soft palate muscles. And next, about the sensory supply, anterior 2/3. Developmentally, tongue develops anterior 2/3 and posterior 1/3 separately. So anterior 2/3 develops from the lingual swellings and tuberculum impar. So anterior 2/3 general sensory is by the lingual nerve. General sensory is by the lingual. Lingual is a branch of mandibular. Mandibular is further a branch of trigeminal nerve. Whereas the special sensory means for gustatory or taste sensation is innervated by cauda tympani nerve, which is a branch of facial nerve. Cauda tympani nerve, which is a branch of facial, joins with the lingual to supply anterior 2/3 of the tongue. Posterior 1/3 of the tongue, general sensory and special sensory, both are by ninth cranial nerve, that is glossopharyngeal nerve. Glossopharyngeal nerve supplies for general sensory, means exteroceptive senses like touch, pain, temperature, pressure, and special sensory, that is the taste sensation. One thing I want to tell you all here about the circumvallate papillae. Circumvallate papillae, they are arranged in front of sulcus terminalis like letter V, I already said. This circumvallate papillae developmentally they belongs to posterior 1/3 of the tongue. Later they migrate in front of sulcus terminalis. That is the reason the circumvallate papillae are also supplied by glossopharyngeal nerve. Circumvallate papillae are also supplied by glossopharyngeal nerve. So there is certain area which is overlapped between the anterior 1/3 and posterior anterior 2/3 and posterior 1/3, which is an overlapping area, which is a mixed area. So remember, circumvallate papillae are supplied by glossopharyngeal. Remaining all papillae are supplied by cauda tympani. Taste sensation by cauda tympani and general by lingual nerve. So except palatoglossus, all the muscles are innervated by hypoglossal nerve. Actually, the palatine muscles, that is palatoglossus, is innervated by vagus and 11th cranial, cranial part of 11th cranial also, and act simultaneously to protrude the tongue. Next, about the blood supply of the tongue. It is by the lingual artery, which is a branch of external carotid artery. Mainly the principal artery of the tongue is the lingual artery. Lingual artery divides into dorsolingual branches and deep lingual artery. And tongue is also supplied by ascending palatine and tonsillar arteries as well. Ascending palatine is a branch and tonsillar artery, both are the branches of facial artery. Ascending palatine and tonsillar artery, both are the branches of facial artery, which is in turn a branch of external carotid artery. And also the tongue gets accessory blood supply by ascending pharyngeal artery, which is also a branch of uh, external carotid artery. So arterial supply, lingual artery, which is an anterior branch of external carotid, which is given off at the level of tip of greater cornu or greater horn of hyoid bone. So lingual artery emerges at the greater cornu of hyoid bone, and it passes deep to the hyoglossus muscle and lies in the middle of the pharyngeal constrictor. It gives off suprahyoid branches, lingual, dorsal lingual branches, and sublingual arteries. It gives rise to, it is not shown here, dorsal lingual branches are shown and sublingual arteries are shown. Next, about the venous drainage, the lingual vein drains into internal jugular vein. You can see here internal jugular, the lingual vein, the principal vein drains into internal jugular vein, and deep lingual vein is the principal vein of the tongue, which is visible on the inferior surface of the tongue, where we saw, which is present on each side of frenulum linguae. And vena comitatus accompanying the lingual artery are joined to by the, you can see the two vena comitatus, they get joined by the dorsal lingual veins, and vena comitatus accompanying the hypoglossal nerve also drains into the internal jugular vein. These veins at the posterior border of the hyoglossus muscle to form a lingual vein, and which drains into the either into the facial vein or into the internal jugular vein. So that is about the venous drainage of tongue. Next, regarding the lymphatic drainage. Lymphatic drainage, we can remember the tongue, below the tongue, here just below, you can see me I think, below the chin, it is called submental region. So the lymph nodes here are the submental region. On each side of the tongue, here are the submandibular lymph nodes on each side. So we can remember the tip of the tongue drains into submental lymph nodes. On each side of the tongue drains into submandibular lymph nodes, and the middle and the posterior part of the tongue deep cervical lymph nodes. Posterior most of the posterior one third of the tongue drains into jugulodigastric lymph nodes. So the lymphatic mainly grouped into apical vessels which drain the inferior surface of the tongue into submental lymph nodes, which drains by piercing the mylohyoid muscle, and their efferent go to the submandibular nodes mainly, and some across the hyoid bone to reach the jugulo-omohyoid. Marginal vessels drain into marginal portions anterior two-thirds of the tongue unilaterally into submandibular lymph nodes. And the central, the green one indicates the central portion of anterior two-thirds of the tongue, either on the midline. They pass vertically downwards in the midline between the genioglossus to drain into deep cervical lymph nodes. Lymphatics play a very important in spread of carcinoma of tongue. So that is the reason we should know the lymphatics of tongue. Clinical importance of anatomy of tongue. So diagnosis, the tongue is the source. As soon as you go to any physician, we usually protrude the tongue and see whether the person is anemia or having jaundice or cyanosis. These three can be indicated. And carcinoma of the tongue, we know the lymphatic drainage, how the cancer spreads from the tongue to others. And inflammation of the tongue is called as glossitis, which is a severe painful condition, and ulcers of the tongue, and some congenital anomalies like absence of tongue is called aglossia, and partially formed tongue is called hemiglossia, and frenulum linguatis attached to the floor, too much it is attached to the floor, restricting the movement of the tongue, it is called as tongue tie or ankyloglossia. Then bifid tongue, that anterior two-thirds the tip, if they are not fused to both the halves, it results in bifid tongue. So we can see the ulcerations of the tongue. Ulcer may turn into chronic ulcer, sometimes may turn into cancer, especially due to artificial dentures. And lesion to 12th cranial nerve, that is it results in the deviation of the tongue to the side of lesion. Please note down, deviation of the tongue to the side of lesion occurs in the lesion of unilateral lesion of hypoglossal nerve. Protrusion of the tongue is not possible in the damage of, so in the which muscle? So protrusion is by which muscle? Which muscle is the safety muscle of the tongue? I hope you all know the answer. The answer is genioglossus muscle. Anterior two-thirds of the tongue is demarcated by, I hope you all know, the sulcus, which separates anterior two-thirds from posterior one-third, is sulcus terminalis. Taste sensations from anterior two-thirds of the tongue is carried by. So the tongue sensation from anterior two-thirds of the tongue is carried by, I hope this also, it is chorda tympani nerve, which is a branch of facial nerve, which after towards the facial nerve, and that is from the geniculate ganglion, and it joins with the lingual nerve to supply anterior two-thirds of the tongue. The taste pathway from the circumvallate papillae of the tongue goes through. So, if you all remember, all the papillae are supplied by chorda tympani nerve, except for taste sensation I am talking, except the circumvallate. So, circumvallate is supplied by ninth cranial nerve. So, the answer is lingual branch of ninth cranial nerve. So, superior visceral afferent, that is fibers from the from the gustatory, that is tractus solitarius, which is the nucleus of taste sensation, from reaches the anterior two-thirds of the tongue, run in chorda tympani of the facial. From posterior one-third of the tongue, run in the glossopharyngeal nerve, and also supply the taste buds on soft palate, and is supplied by the greater petrosal. The soft palate also supplied by the greater petrosal, which is a branch of facial nerve. So taste sensation from the epiglottis is carried by internal laryngeal nerve of superior laryngeal, which is the branch of vagus nerve. So these are the nerves which contain the taste fibers in them. So facial nerve, glossopharyngeal nerve, then vagus nerve, and and also the palatine nerves, greater petrosal branch of uh, facial, which is contain palatine nerves. So these are the branches. So among these, the answer is, I hope you know, lingual branch of glossopharyngeal nerve. Tip of the tongue drains lymphatics too. So tip of the tongue drains to submental lymph nodes.